can start. My name is Fabrizio Turoldo. I am professor of moral philosophy, bioethics, and social ethics at the University Foscari in Venice. I'm also the director of the PhD international program in philosophy and educational sciences, which is a PhD program in partnership between Ca' Foscari University of Venice and the Sorbonne University in Paris. But the most important thing is that I am one of the founding fathers, together with Stefano, Semplici, and other friends, of the summer school on ethics and healthcare. We started 5 years ago here in San Servolo and at the Venice International University.
My name is Stefano Semplici. I am a professor of social ethics, bioethics, and ethics of sustainable development at Rome University of Tor Vergata. In the past, I have been a member and chair of the International Bioethics Committee of UNESCO and of the Committee for Bioethics of the Italian Society of Pediatrics. I am a member of the Italian National Committee for Bioethics, and I'm very proud of helping my friend Fabrizio with this fruitful and exciting experience of the summer school.
My name is Jürgen Maurer, and I'm a professor of health economics and management at the University of Lausanne in the Faculty of Business and Economics. But I collaborate a lot with various social science researchers on issues about mostly on aging, but more broadly also on life course research, as well as with clinicians at our university hospital, especially in the area of end of life and palliative care.
The summer school is characterized by a continuous and intense interdisciplinary exchange between scholars in the field of philosophy, medicine, economy, and jurisprudence. During this fourth edition, the summer school will focus on end-of-life ethical issues, in particular on social inequalities at the end of life, ethic consultation at the end of life, and other issues such as continuing or discontinuing life-sustaining treatment, such as, for example, discontinuing mechanical ventilation, artificial nutrition, and artificial hydration. And then we will fathom also other subjects like for example, assisted dying and euthanasia, ethics of palliative care, altruism at the end of life, and we will talk also about perspectives of nursing professionals with end-of-life care. And during the summer school, there will be lectures given by our experts on these issues, but also debates among students and teachers, focus groups, laboratories, presentations given by students, and case analysis. And so it will be an interactive summer school, not just with lectures, but also with debates.
If I may add a couple of words, building on what Fabrizio has pointed out, I think it is quite easy to understand what the main goal of this initiative is. When we speak about end-of-life ethical issues, the focus tends to be on burning, challenging issues such as euthanasia or assisted suicide. As you can see, our goal is, to say so, to broaden the scope, which implies bringing together different competencies, cultural backgrounds, and expertises, alongside different issues. In this perspective, I think that the mention of social inequalities and inequities in the program is key. If we come back to Article 14 of the Universal Declaration on Bioethics and Human Rights of UNESCO 2005, we see that this point is clearly highlighted. The promotion of health and social development for their people is a central purpose of governments that all sectors of society share, This is precisely to underline that what we are talking about can be, and actually is, a responsibility for everyone, not only for the so-called experts in the field of bioethics. I think this is really added value by this summer school. Also recalling the experience of the previous editions, which already had exactly this perspective.
So I think Fabrizio already mentioned quite a few, right? So my own contribution, I was thinking of focusing on issues related to inequalities that Stefano had just highlighted. Also, so we're doing a bit of work on sort of inequalities, not only in terms of age at death, which is very well documented, right? That less privileged population groups die considerably younger than more privileged population groups, but also on other circumstances around the end of life. And so some things that come to mind is there are obvious differences that are related to life expectancy, relating to cause of death, but then also, the supportive care environment at the end of life across different population groups differs considerably. So, do you just rely on informal support? Do you have mixed formal, informal support? How easily can you navigate potential support offers? Can you financially afford support offers? And so I think there are a lot of important questions with regard to that I would at least like to raise. So I have only one slot, but so it would be really about the socioeconomic contextualization of the end of life, if you want.
As I already tried to underline, also looking at my personal contribution to this edition, which will focus on issues related to assisted suicide, euthanasia, and palliative care. The main point to look at is the fact that there is nothing easy to grapple with when you come to these questions. So that when it is about imagining a program, the idea is not only to bring together different competencies and backgrounds, as it has already been said, but also to raise questions. To raise questions. This is the idea. So when you look at the titles of the different sessions, you always have to look at them as opportunities to raise questions and foster a debate. So the floor is open, not only for the week of the program, but also afterwards. This is also a point that I would like to make. When you have such an interesting opportunity as living together for almost a week in a venue like Venice, which is something by itself, of course, you establish relationships, contacts. I use the word friendship, which are a sort of bridge to the future for those who had the opportunity to participate in the program. So this is what we are aiming at, establishing a working group not only for today, but for the future too.
I totally agree with Stefano. I want to say and to stress that we are a group of scholars deeply interested in the topics of ethics and bioethics, but also, as Stefano said, a group of friends. And so our initial idea was to bring into this summer school our expertise on one side, but also the typical climate of friendship, collaboration, and passion which characterizes our meetings. And thinking back to the previous editions, I think that this idea worked also thanks, as Stefano said, to the special atmosphere which characterizes the island of San Servolo. We are in a beautiful island, very close to San Marco, and to other beautiful islands. And we stay there for almost a week, discussing together, having lunch, dinner, and breakfast together, walking on the beautiful gardens together. And so for some days we really live the campus atmosphere. We have a really real experience of a true campus with our students, with our colleagues, and I can assure that this is a wonderful and unique experience. And every time people who come to this summer school are very, very happy, and they stress the unique climate of this summer school.
Maybe we could also add that the progressive broadening of institutions and colleagues participating in the program provides evidence of that. This approach is fruitful and seems to be quite successful.
I think that attending this summer school means developing transversal expertise, since the approach of the summer school is multidisciplinary, as you could see. Jürgen is an expert in the field of economy. I'm an expert in the field of ethics and philosophy, etc. So there are many different expertise, and so students will learn how to connect issues between the health dimension of health end of life and the ethical, legal, and economical aspects of end of life. And moreover, the students will have the opportunity to test different perspectives of thought and different theoretical systems in the light of extremely important and current case studies. And I think that this is also a special feature of the summer school.
Get used to raise the key question, to point out the key questions, and to test what solutions have been offered, and which solutions can be the most promising ones, leaving the floor open for future debate, also through establishing relationships and friendship looking to the future.
I have not much to add, but I think perhaps it's also always a challenge, but also a very rewarding exercise to try to find a common language across the disciplines, right? I think that's also something that makes interdisciplinary summer schools very exciting, to kind of get fresh perspectives, but also find a way to communicate about these perspectives and potentially even integrate perspectives, or find kind of ways of how should I say? I'm missing the English word. Trying to achieve some sort of synthesis of common themes that one can illuminate from different perspectives across the different disciplines. So I think this is one of the things I'm looking forward to. So, as Fabrizio already said, we have experts from many different fields, but also there will be a clinician joining us from Lausanne, and she will also bring very important perspectives from the bedside. So I think it's really sort of from the study to what we see in society through like actual clinical and health policy practice, which is a nice connection, I think, that you can achieve through a multidisciplinary summer school like the one we have here. Maybe I can say very briefly, so I'm not, I didn't set up the summer school, right? But I was quite eager to join it. And for me, at least from a perspective of an economist, it's also nice to combine like disciplinary perspectives that are often more descriptive, I would say, with really the bigger value and normative questions that often present themselves. And without those, you can actually not make concrete proposals to move things forward. So in economics, we are often in the business of just describing a situation and highlighting trade-offs. It could be this, it could be this, but then you ultimately need, ethically informed value judgments to bring this to some actionable policy proposals. And so I'm quite excited to be allowed to be part of a group of friends who are much more knowledgeable about, the value and ethical aspects to kind of really help sort of synthesize also my own thinking about the topic, and thinking about how this can be used to inform, I think, practice and ultimately the life of people. And also this is what we're trying to do very down the road. And so I'm very excited to join this group.
Usually the group of students is really, really very heterogeneous. And this is, in my opinion, one of the reasons of the richness of our summer school, because there is a difference in age. We have usually young students, but also middle-aged professionals, and also retired professionals. And so differences in age, differences regarding the subjects which the students are interested in. We have students from philosophy, jurisprudence, medicine, economy, etc. We have students coming from all over the world. In the last edition, there were students from 4 continents: America, Asia, Europe, Africa, even from Africa. It's very, very rich and stimulating. And so, this is one important aspect. And we have PhD students, but also professionals, and also students, master students, and so very, very heterogeneous. And I like, and also the faculty is heterogeneous, and this is, I think, one of the reasons of the success of this summer school. Yeah.